Okay, heel pain, plantar fasciitis, treatments. It's a difficult thing to heal up. It can go on for a long period of time. It often needs a combined approach. One treatment by itself is not going to sort this out. You have to be really mindful of how much load you're putting through it. But stopping totally isn't usually a good thing unless it is really acutely painful and we need to offload it. Trying to keep it moving is much better. So in the first instance, we can use taping to strap it, which will take some of the load off it. This does help rest the plantar fascia. I usually recommend this for maybe 3 or 4 days maximum, and then we need to start getting movement into it. So they're the basic sort of stretches of sitting with a TheraBand and pulling the foot up towards you and then pushing it back down. And that's a good way to get some gentle movement back through the plantar fascia and back into the calf muscle as well. So we can then do that with the toes and also with the foot. You can do that in a sitting position, you can do it in a standing position, and then we can do it off a step as well, once we feel this is able to take the load through there. Other treatments involve injections, so we can use steroid injections, which come into the side of the heel here. These are always done after an ultrasound scan, which we can do in the clinic. And the injection is always ultrasound guided, so we make sure we're getting to the steroid into the correct place within the plantar fascia. On the ultrasound scan, we'll often see a thickening of the plantar fascia. The normal recommended sort of range is 4 to 5 millimeters. Sometimes these can be anything up to 10 millimeters thick, where the band of the plantar fascia has opened up and we're getting a lot of fluid into the area, and the steroid injection just goes and reduces that. We can also do the hands-on manual therapy of actually massaging through into the area, making sure the foot is mobile, working as well as it can be. That just helps everything start working again. We've got to get these tissues used to taking the load. We've got to build up their ability to take that load, not just hold it back for a long period of time, as we would with strapping. We need to build the tolerance within the tissues. We can also use orthosis, again, to give that arch that little bit of help, so we're getting less movement through the foot. Again, that can be a short-term or a longer-term treatment. And the other treatment that we have is shockwave, which is a machine that delivers a high-intensity shock or an energy wave into the tissue. Can be a little bit uncomfortable. It doesn't need to be really, really painful, but you do need to feel the shocks going into the tissue. This is stimulating the body's own repair system. So it stimulates tissue damage without actually causing the damage. And it brings all the repair products back into the area. So we're increasing blood flow into the area, removing the fluid from the area, and altering the nerve sensation into there as well. So it almost has a local analgesic effect for a short period of time as well. All those treatments we'll discuss once we've gone through the assessment and had a look at it. We'll also talk about load management. This is a really big thing. So all these treatments, the stretching, the injections, the shockwave, the orthosis, are all still going to need to be managed by how much you're using your foot.